conscious patient or unconscious patient. Well, at the end of the day, if you walk in the patient room to suction this patient, and the catheter was not going down, and the man needed suctioning frequently. Every time I go in there, if I suction him with the catheter, what am I going to do to his nose? I'm going to cause bleeding, right? And so therefore, you put a nasopharyngeal airway in
You better
place.
protect the, is that what you're saying? Right.
Yeah, I mean, if you put a nasopharyngeal airway in place, you can suction in and out through the airway instead
Right,
of
and you're not,
scraping the nose,
mucosa.
you know. It's going to cause bleeding. So, nasopharyngeal airway is for suctioning. The other reason you have is for an airway. Like somebody's tongue is falling back into the back of the throat, and they are snoring. They can't get the air in. You put a nasopharyngeal airway in place, so you can move the air in and out. So right before we intubate somebody, sometimes we put a nasal airway in and use a mask and ventilate it. So
They're just like a trach, they're kind of like they're projectile.
right. And we don't have a whole lot of patients that have nasopharyngeal airway in place and stick it and leave it there. Sometimes we'll take it out. We leave it for 24 hours, then we'll take it out.
But if you also had a patient that something was wrong with this
Upper airway.
effort, and you
They had
had to
injury.
go,
They had dental
yeah,
surgery.
Okay.
right, you would use it, right?
Yes.
Okay.
Mainly we use it for suctioning.
Okay.
That's what we use.
If the patient, you know, is a frequent suctioner and he needs it, you know, every day, how long would you leave that in?
Well,
Does it
you're
have to
supposed to
change?
remove it 24 hours and replace with a new one.
You switch
Can
sides.
you imagine?
Switch sides.
Yeah, you can switch sides too. Yeah, and put a new one in, otherwise it get all nasty and stuff. And we don't do, and you're gonna do that. What do you think, Lena?
Plus, the thing could have leftover mucus that's getting dried in it, and you can't see it. So you think.
So do you have to kind of, when you
That's all we
suction, do
do.
you have to twirl with that too on the way
It's so
out?
hard to do. Usually
Yeah.
it's stuck and you're trying to pull it out.
Yeah.
Because the airway, the catheter,
Yeah,
you know, so yeah, that whole term is not gonna happen.
okay.
That's why we replace it and just give them a clean one each day.
Couple things you have to remember with nasopharyngeal airway is if you put a small, very small one in somebody, you won't be able to put that catheter down through it, right? Every time you attempt to suction, the catheter won't go down because you're a smaller diameter, right? So you have to find the right size. That's a key. If you put it too big,
Then it'll
nasopharynx,
cause
what's
more
gonna
damage. You
yeah, it's
don't
gonna
want
damage,
yeah.
right? How about some kind of nasal septal defect? If you have a right nasal septal defect, what are you going to do? Like he's trying to attempt to put it in, it won't go down. He's trying
Use
to-
the other one.
And if he can't do the other side, what are you going to do?
Who wants to try it?
Find another one.
Nothing you can do. Keep moving. Yeah.
Well, you mean literally try it for
We have
real?
some sterile ones here.
Are you crazy?
You're gonna scrape the
way.
nasal. Yeah.
Not me?
They make you.
We'll let you be the patient.
All right, let me ask you all a question. What is epistaxis?
The status.
Epistaxis?
What he said.
Where's it written? Is it on here somewhere?
Yeah.
Say it, John, what is it, do you know?
What do you know?
It's not, I didn't see it, but that's,
What do you know?
It's on page 2 of the pharyngeal airway packet. At the top,
epistaxis,
at the bottom of the top slide.
like taxes.
Keep asking.
Nasal bleeding, John is right, he gets an A.
Nasal pharyngeal airway can cause epistaxis.
So say that word. What can it,
That's the Indian
nasal,
Oh, come on.
Nasal bleeding.
That pronunciation.
Some page to a first slide.
looks like epitaxis.
So you know on your boards are gonna be all these words. They're not just gonna say, if your patient's nose is bleeding. So all this
You can go out to the nurses and say, hey, I tried to put that nasal trumpet in the patient, but it caused epistaxis.
We'll have to run-
Is that a code? Do we need to call code?
Do we need to call code?
Run the code button.
Relax.
They'll be looking at their
So,
book, what does that mean?
My sentence, I use that, so start one sentence.
Alright, now, how do you measure this?
The earlobe.
Tip of the earlobe
To
to
The
top
nair,
of the nose.
size of the nair.
Yeah, you gotta do
Read
that
that for
first.
me.
Get the size of the diameter of the,
Outside diameter of the airway should be equal to the
Inside
inside
of-
diameter
of
of
the
the
nair.
patient's
so
external
you do that
nares.
first.
Oh, so you look at the patient's
Nose.
nose, pretty much kind of figure it out. Don't put your finger in there and try to measure it.
Yeah, that's the size of my pinky.
I saw a nurse doing that the other day. Sticking her finger
You know, she's digging the gold.
Gross.
So do you kind of like take a couple of different ones and kind of like look at the end of it? If they're all
in there.
in
Yeah, just
packages.
look at it, just look at it.
You
So
blow
how
in
do you
it, you
measure it?
blow in it, Kathy.
I would
and
think
see
you
which
would
is
put
it.
Tip of the
Well, I'm talking about-
ear
oh, the
Tip
measuring?
of the earlobe
to
the
the
nostril.
tip
Are you
of
talking
the
about
nose.
that?
Tip of the
Watch me.
earlobe to the
Tip of the nose.
nostril,
Nostril.
the middle, or just side?
Length of the airway from the tip of the earlobe to the center of the nostril.
Okay, so this is actually too small.
It's gotta be to the center.
How about this?
No.
Yeah, baby.
Yeah.
Ooh, does that
You're
hurt?
gonna get bagel response on that one.
Oh, forget that guy. How about this?
Wait.
The tip.
Don't let the
That's
faces keep
the
coming out of
center
it.
It's
of
like a six.
Oh, there you
It's
go.
probably a better, yeah.
Good.
What? Yeah,
Yeah.
the
that's
center,
perfect. No.
right here,
It looks huge.
Not going
right,
forward.
right here,
It looks
So
too
you
big.
measure
to me.
it from the tip of the earlobe to the middle of the nostril.
right
It's too
here.
big. I
See
like
in
the
middle?
first
Of
one
the
better.
choices we had,
Center of the
The
nose.
central.
Kathy, try
Center.
that green one.
Center
Do you want it to the
right
tip of the
here.
nose?
You want it to like
No, I think-
The
center,
inside
The
of
first
the
one was
center of the
better.
nostril.
This is.
So you guys
This
saying
looks
this is
small.
too big? Is that
Yes.
what you're saying?
Yes,
Yeah.
because it's on the
Come
tip
on,
of
guys.
The
the nose.
first one was better. It'll be-
John's saying this is better.
That'll be
Be able
more
to
well
come out of
tolerated
there.
by the patient. The
Not-
first one.
Which one? This one?
The one, well, it's a little small diameter wise, but length wise, it would be tolerated
But it's
best.
not a, well, it's
It's not
not,
long enough.
It's going to the
It's not long enough.
nostril and it's
That's what it
typically,
looks like on here.
it's going to the middle of the nair by textbook definition.
yeah, whatever.
But that'll also be tolerated
But the
better.
thing is, the only issue with this one is, that look
Too
at the
narrow.
catheter. If you want to suction.
Okay, just tell me this, when you're saying the middle, you're saying the center of the nostril, or are you saying the middle of the
No,
nose?
the center of the nostril.
Okay,
So,
the middle of
so,
Put that big one in.
the
Center
sizing,
middle.
John is
Yeah,
right.
outside the
The
box.
sizing is, John is right. But the diameter, look at this back.
Yeah.
Yeah.
Look at that.
So you would go a little bigger?
Yeah, I mean, if you really want to
You have
suction the
to.
patient, you
Always
want to.
err on being slightly bigger,
Because you don't want to,
right?
Let's say you put the yank hour down there.
Yeah. But the problem is, if you try to put this one in and it won't go, then you can try this.
Well, there's probably another one sized in between
Yeah,
those two.
yeah, we don't have to.
But I mean, if this was truly for an airway and not suctioning, use the bigger, I mean, get the bigger airway. If you're trying to honestly use it for an airway,
Yeah.
you know,
Correct.
saving their life at that point. Yes, it's gonna hurt either one
Is
of
the
them.
hardest part, I mean, is it like the size of their nair indicative of the size of their entire, like
Back
nair?
behind
So if
the
you
nair.
can fit it through there, you can fit
Yeah.
They got-
If there's no
Big
deviated
here,
septum, and-
If it's big here, it's gonna be big
yes,
inside too.
yeah.
All right, now, how do you put this guy in? That's the question. What position the patient should be in?
sniffy
Should be sitting
Do I
side
need to
dollars.
turn this upside down like I did on the other
you
one?
have to put it,
The tip towards the nose, the tip towards
The
the
natural curve, natural curve. But when you do the checkoff, if you put it in like this, you fail the checkoff. So natural curve.
Like you're supposed to put the bevel against the septum and then rotate as you go.
And that's, no, I know what you're saying.
Flat part towards the septum and
And
then
then
Well,
just
this
follow it in.
became
Yes.
a very big issue last year, doing the checkoff and in the lab. Kathy Wallace usually say that this side should be on the side of the nasal septum and put it in like that. But the problem is if you're putting it in the left side, how do you put it in? You have to go upside down first, then turn and all that stuff. But if you wanna do like that, it's okay, but it's kind of get complicated. So we just tell them, like the book says,
Okay.
just
Follow the natural curve.
Probably good advice.
Keep it simple.
See, we could check off on that.
But you're supposed to lubricate it too.
Yeah, yeah. The only difference is we have to lubricate this guy before you put it in, okay? And oral airway, you don't lubricate. This one, you make sure you lubricate. If you can get it through one nostril, try the other one.
Do you
Don't
use
force
just
it.
regular gloves on this?
Regular, this is an aseptic procedure.
Okay,
You do not need to put sterile gloves on.
okay.
Lubricate, try to insert, and if it doesn't go in, do not jam it in there, go to the next one. Try.
So there's no turning or nothing, you just follow the natural
Yeah.
curve and you're
But
done?
if Kathy Wallace, she might talk about this
Yes.
side, but you're not really strict about it. Natural curve.
How much resistance will you get?
A little bit.
Turn that to
Can we
the
bump it
inside. Let me just see
So then
you.
when you put it
With
down,
the
it's
tip.
gonna go like this.
Now go on the other net and flip it. Before, right now. If you put that in, is that where she was talking about curving it?
Yeah,
like
I mean,
that?
she's saying that you hold it like that, and turn and stick it in like that.
Did y'all see that? They always suggest to keep the tip towards the septum, and that's the easier way to put it in.
This
Like
this
if you
little
turn it the
cut
other way,
right
it seems
here.
like it's just gonna gouge into.
Yeah, it's
I think
easier to
that's-
stick it in there.
And that nominal
She wants
bone
this
structure
cut
is
piece
But it's up
to go on the
Push it
side
in,
like
just
that.
Somehow that will
Instead of
anatomically
this side, probably.
slide in easier.
When you get the
I mean, I never
Shoving
seen
something in
it.
my nose, just show.
I know, right?
It's not-
You would think it would bother you more if you had to rotate it
Oh,
though.
yeah.
I mean, this is not really sharp either, this is very.
Well, that
soft.
green one's even softer. That green
Yeah.
one's soft, really soft.
It's really not gonna do it damage.
That's the one I want down my nose. Get
Well,
the-
that's what she said.
So
the
what's,
green
what's
one.
Check it out.
in hospital, what's the
Yeah.
general thinking as far as how long they should stay in and there? I mean, I always just put them in the outpatient, I'm never worried about it. In the hospital,
Only as long as they absolutely need it. If you're not suctioning them
Just put it on the
anymore,
right one, that way.
don't use it.
okay, let's assume he needs it for 7 days.
Change
You
it
put
every
one-
24 hours.
4 hours, okay.
All right, guys, now it's time to practice. Come on over and practice.
Sorry, I didn't know.